overall thinking of Honorable Chief Minister. With these words, I express my gratitude to the organizer, especially the HR group of institutions, which has given such a wonderful platform. I was Ghaziabad 2 days back and seeing good hoarding throughout the Ghaziabad. When I was entering into from Delhi to Ghaziabad, I appreciate the efforts made by the Honorable Member of Parliaments, and I express my gratitude to Dua ji, to Asim Sahu ji, all the people who are physically present over there. And Dua ji, I am very thankful that in spite of all the issues, you are assisting the UP government. And Asim Sahu, your role would be very important, as you played earlier also. I was discussing CDRI has submitted some of the plan. You can play the role of hands holding and see the things be executed properly. If the rules come somewhere, we are having open mind approach to get it changed, as we did as DCGI. And Dr. Somani is there, who is equally a dynamic person. You take their help and make it to happen. With these words, I express my gratitude to all of you and giving me this opportunity to be on this platform. Though I have taken more time, but it is, I thought I must share. Thank you very much.
Thank you, sir.
Thank you, sir. Thank you very much, sir. Now, as per the with the permission, Mr. Gupta, should I request from Federation of Pharmaceutical Entrepreneurs, Dr. Dua, or should I ask Dr. Asim Sahuji? Because I think one regulator have speak about the pharma policy. So, should I ask the one expert from the industry?
Yes.
Yeah. Mr. Gupta, am I audible?
Yes, I'm audible.
Okay, fine. So this is we were listening Dr. GN Singh, sir. He has served the Indian Pharmacopoeia Commission as a director, scientific director, and he served as a DCGI, Drugs Controller General India. The topmost position of pharma profession in the regulatory. And he is now the pharma advisor to Honorable Chief Minister of Uttar Pradesh, Yogi ji. Now I request Dr. Dua Saab. I think his profile is, he's a very senior person in the industry, and he is. This is only sufficient to tell at this platform that he is represented in front of the Government of India, the Joint Parliamentary Committee, about the pharma industry and how to increase it. And we are seeing his contribution in increasing our productivity. The development of the industry in India. So, Dr. Dua sir.
Thank you very much for the introduction, Honorable GN Singh Saab. I think you've forgotten me, Dr. Singh. And here you, doesn't matter. Dr. Sahu. Dignitaries on the dais and digitally present today. It's first of all on behalf of FOPE. And FOPE stands for Federation of Pharmaceutical Entrepreneurs. It's a decade-old body, a young, vibrant body, which I'm representing today. And we have a membership of close to about 450 members, predominantly taken from the MSME, the micro, small, and medium organizations, which are contributing very substantially to the Indian pharmaceutical industry. My thoughts go back to 42 years when I passed out of Indian Institute of Management, Ahmedabad. I did my MBA after my pharmaceuticals graduation. And believe you me, I walked into an executive position in the largest pharmaceutical company in the world called Hugs. If you go to Nariman Point today, you will find out a beautiful building called Hugs House. That's where I was located in the first year of my engagement post my MBA. And at that point in time, India used to import everything, right from APIs, intermediates, down to the last formulation. Everything was being imported in 1979. Thanks to the political dispensation at that point in time, when we refused to sign on the dotted line, in the Uruguay round of talks, which led to development of generic industry in the country. So from being a net exporter 42 years ago, we become the pharmacy to the world. Today, I'm very proud Indian when I would tell you that India has been acknowledged as the pharmacy of the world by no less a person than Honorable Prime Minister of India, Shri Narendra Modi ji, and also by practically all the heads of states of the world. I was the chairman of Pharmaceutical, which is a part of Ministry of Commerce, for close to about 3.5 years. And believe me, the amount of work and value addition globally, which has been done by Indian pharmaceutical industry, no other industry has been able to do that. It's an industry which has come to the fore in the pandemic in the last 2.5 years and continues to play its role, not only in formulations, APIs and intermediate, but also in vaccines, as you know. No other country except India has met entire demand of the country through vaccines as India has. I mean, if you were to look at Pfizer, Moderna, and Johnson & Johnson all put together, right? The population of the US is only about 30 crores, 300 billion people, right? Whereas our population, as you know, is 1.3 billion. So that being said, it's amazing amount of work which the Indian pharma industry has done. The size of the industry currently, as all of us know, is close to about $50 billion. 1 billion is 7,500 crores. So it's a very big industry with 3,000 lakh crores worth of business which is being transacted, and it's vertically divided. 50% of the business is done in domestic, and 50% of the business is done in exports. Very proud to say that no other country in the world exports as much as we do. From a volume standpoint, India is number 3 in the world. And from a value standpoint, at $25 billion, we are number 9 in the world. So you can imagine that there is such a huge amount of arbitrage which sits in terms of unit pricing of the pharmaceuticals vis-a-vis the West. We can produce a drug at 1/10 and in certain cases even at 1/100th of the price that US and Europe makes. That's the amount of excellence. We have the largest number of US FDA approved plants, largest filings of ANDAs, which is a pathway or a passport to induction into the biggest market in the world called the United States. Even US does not have that kind of filing, that kind of success that India has in the United States. So overall, at a macro level, India has arrived and India is respected in a huge way as the pharmacy of the world. Now let's come to UP. There are about 15 clusters of pharmaceuticals in different shapes and kinds, starting from intermediate API to bulk drug, which is predominantly concentrated in Andhra Pradesh and Telangana, then onto some bit in Gujarat and Maharashtra. And then you have some other clusters in APIs, which are spread all over the country. But basically 70-80% is located in 3 states, as I said. Formulations, there was a time when I was in Hertz and various other companies, 70% of production used to take place in Maharashtra and Gujarat. Then it went over to Telangana and Andhra Pradesh. And lo and behold, our neighboring state, Himachal Pradesh and Uttarakhand, and now Sikkim in the northeast. You'll be very surprised to know that 40% of the production of Himachal and of Uttarakhand is for the country. That means out of a total market of $50 billion, close to about $20 billion on the MRP is produced out here in the neighboring states. Where do we stand in Uttar Pradesh? I mean, you'll be surprised to know that the contribution of Uttar Pradesh in the pharmaceutical industry of the country is just about 2,000 crores. Where is 20 billion, 25 billion, and where is 2,000 crores thereabouts? If small little hilly states can contribute to 20,000 crores worth of manufacturing production in the country, why can't UP do that? There are different reasons for that. I have 2 units in Himachal, and I have a very, very large 120-acre plant, one of the biggest in the world in antibiotics. Look at them and look at UP. UP is the second biggest in terms of industrialization, but in terms of pharmaceuticals, it lags behind. And Honorable Jane Singh Sahib very, very well articulated. Look, here's a time when under the dynamic leadership of Upyogi Yogi ji, as we say, Honorable Prime Minister has started Upyogi. UP is U and Yogi ji is Yogi. So Upyogi, Honorable Chief Minister, whom I've met a couple of times, is very keen that the pharmaceutical industry must flourish. And in order to do that, I will not go into the SWOT analysis for reasons of time constraints. I will just say 2-3 things that we need to really look after is that we have to create an enabling ecosystem in UP on the lines of Gujarat to start with, as well as on the lines of Himachal and Uttarakhand to a large extent. And what are these measures? Having interacted in folk with a lot of participants from UP, first and foremost is that, as is the case in Gujarat and UP, the layout of the plant must be pre-approved before we go ahead and start constructing the plant. That's not the case in Uttar Pradesh. Since this is something, sir, you need to really look into, that the layout has to be pre-approved so that going forwards, once you started construction of the plant, there should not be any problems, issues, and challenges. Online applications, since I can tell you in Punjab, where we have such a huge plant producing 2,000 crores worth of APIs being exported to 125 countries. There is a very simple principle, sir. The principle is you apply online, within 7 days, if you get the approval, or in certain cases, 2 weeks or 30 days, it is deemed as approved. You don't have to do anything else. That is not the case in UP, sir. I've personally verified this. I've interacted with a lot of industrialists and pharmaceuticals who we hold the same sentiment. Thirdly, that there is no time-bound disposal of the applications which are given to different state authorities as well as FDA. Overall, the feeling of the industry, sir, if you kindly forgive me for saying what I'm going to say now, is by and large negative. These are delays galore. Once you set up a plant here in UP, it takes you minimum 3 years to get into production, get into revenue more. Why would an industrialist come to UP? And in the neighboring states, it takes you just 6 months to get started, 9 months to get into production, and 1 year to start making profits. So the payback, or internal rate of return, as we call it in business, becomes very conducive on the lines of leading states of the country like Gujarat, Maharashtra, Himachal, Uttarakhand, and now also Northeast and Sikkim. Same kind of a scenario. So, and lastly, one more thing, which is slightly technical in nature. If there is an existing molecule which is being produced, and I have produced stability data in my research and development laboratory, that data should be considered as stability data, and then the producer, the manufacturer, will keep on filing 3 months accelerated, 6 months accelerated, by which time it should be in the market. Now here, it's only after you manufacture the first commercial batch, you're going to give 6 months data. So your time to the market goes to anything between 9 to 12 months. Now, who on earth will come to this state if you have this kind of legislations which impede the functioning of a manufacturer? I'm not talking about new drug, I'm talking about an existing molecule. So with this, I would just wind up by saying that UP is naturally gifted. UP is very fortunate that we have one of the most dynamic DCGIs, Dr. Jane Singh, guiding the Honorable Chief Minister Yogi ji. Nothing must come in the way. I've very closely studied the policy, pharmaceutical policy, or life sciences policy, whatever you might call it, 2018 and the amendments thereof. I think that needs a very serious look. Ease of doing business is the name of the game, sir. India has leapfrogged in the last 5 years from 117 to 63rd position. I'm sure latest figures are indicating we are less than 50. Now, if we can leapfrog in terms of ease of doing business from where we were 5 years ago as a country in the world, why can't we do that in UP, sir? UP is lagging behind. We are all with you, sir. Whatever you say will be done. With a very strong membership order of 450 wonderful industries can bring about huge amount of value addition, provided UP can facilitate ease of doing business, look pragmatically and progressively at the policy legislation, and who else can guide and people like Dr. Sahu, Dr. Sumani, Dr. Ishwar Reddy, Chandrasekhar Reddy, and of course yourself, Dr. Singh Saab. With these words, I'll just stop here and thank you, Honorable MP Saab and Elakwalaji and Anjulji, for having invited folk in this forum. I'm sure in this interaction of relevant people, our voice will be heard and actionated upon, and inshallah, sir, we will see you be leapfrogging from a very poor position below 10th state in the pharmaceuticals, possibly the top three. If UP can, I'm sorry, if HP and Uttarakhand can do it, MP is taking very major initiatives, sir, to come in the forefront, and you have very, very large sprinkle of pharmaceutical companies. Why can't UP, sir? With these words, I thank you, everyone, for kind patience and for having me here. Thank you.
Thank you, sir. Thank you very much, sir. We'll be definitely again discussing that with Dr. Jian Singh sir. I think Dr. Jian Singh sir will be keen to, I think, say something. But before that, I'll just request our Deputy Controller India North, Dr. Asim Sahuji. So he can show some light towards the pharma policy and the role of CDSCO. We are having a guest from the State Drug Control Department also. They are viewing us through the Zoom platform. So, sir.
Good afternoon. First of all, good afternoon. Good afternoon. Yeah, Honorable Dr. Jian Singh sir, my boss. Lot of things I have learned from Dr. Jian Singh sir is tenure in the CDSCO. The Dua sir, Indian Pharmaceutical Association, who distinguished guest. I would like to especially thanks to Dr. Puneet for inviting me to this program and sharing my regulatory whatever the major syllabus taken by the government of India. Dr. Jain Singh sir has explained regulatory policy of the UP and whatever the measures taken during the last 5 to 10 years in the regulatory system. Dr. Jian Singh sir was the instrumental at that time, and lot of new initiative has been taken during the period of Dr. Jian Singh sir. In business, we have taken various steps, and one of the major steps we have done in the period of Dr. Jian Singh sir, that is the Medical Device Regulation 2017. That new regulation that has come into effect from January 2018. Before that, we don't have the major or comprehensive regulation on the medical device. And the medical device industry, the growth of that industry is also going at the rate of 15% as per the CAGR. It is not a small industry as far as the device is concerned. And mainly we are depending on the import, the medical device. So the need for the complete regulation, that was the concern at that time, and Dr. Jian Singh Saab has taken the proactive measures, and the new comprehensive rule has now come, and at this time we are controlling almost all the medical devices in a phased wise manner. And in India, the regulation what we have framed, that is at par with the international regulation. So ease of doing business, we have taken steps since last many years, and now Dr. B.J. Somani, who is the present controller, at this time also the government is proactively taking the various measures and new rules. We have simplified various rules before 2017, and now also, and in ease of doing business, the various measures by amending the rules to simplify the regulation, the government is initiative, And consequent to that, now the licenses are issuing, drug licenses are issuing in perpetuity. So, so that there is no any further problems for getting the renewal of their approval. Only certain requisite fees structure has to be paid by the manufacturers, and their license will be valid till this suspended or cancelled or withdrawn by the manufacturers. Various new rules, that is new the city rules, have also been modified, and new rules 2020 has come up. Cosmetics rule 2019 has also come up, and this new rules, whatever that we have prepared, that is in that rule we have clearly mentioned the timeline. As Dr. Dua has explained, there should be the certain timeline for the processing of the application. If you see these new rules in the medical device rules also, we have given the specific timeline for processing of each and every applications for new drugs and clinical trial 19 and the 30, the activity structure. This online portal have already been implemented, and the licenses are issued through online only. For other also, the government has taken steps, and new centralized online drug licensing system has already been set up. Now, some of the states have the portal for some of the states have already functional. Delhi, Haryana, recently day before yesterday, the uh, licenses are submitting in Haryana through that online licensing system. UP also we have created that credential. So all the licensing system the government is going to do through online only, so that the person sitting in the south can directly submit their application to the central authority or as well as their concerned state, and they can get their license through online only. No need to come to the offices or central for collecting the forms. Not only this, the audit program also, we are coordinating with the state authority and the central joint inspection. We are doing. We are our zonal offices of CDSO are located in various locations of the country, and each state certain zonal office has coordinating with the concerned state licensing authority and the jurisdiction. And we are trying to clear the applications in time bound manner. As far as the productivity system is strengthening, the central government has also taken the various steps. They are providing the financial assistance to the state authority for strengthening of their regulatory system as well as drug testing systems. And in UP, if you see the UP, we have given more than 50 crores of the rupees for strengthening of the regulatory system. And glad to inform you that in UP, the drug testing laboratory in future, UP state have more than 6 or 7 drug testing laboratory, which is going to be established by the state government to check the quality of the drugs moving in the market. This is the first time that UP has in future UP will have more than 7 drug testing laboratory. Strengthening of the manpower also, the government has already initiated submitted various proposals to the government, and their manpower is also strengthening to have timely clearance of the applications. So, lot of steps has been taken by the central states as well as the UP states for growth of this industry. And as Dr. Jean Singh Saab has conveyed that the new pharma park, API park, and tech park that is going to, the government has already planned, proposal has been already been submitted. So definitely with this effect and simplification of the rules and strengthening of the regulatory system. I'm quite sure in future the industry in UP will definitely grow. And whatever the measures ready to do, only the concern of the quality of the medicine. The medicine should have the quality medicine available in the country. The facility, the manufacturers, they should have the quality system. They have to implement the quality management system so that the quality of the products is monitored not only the final stage. However, in each stage, the quality should be monitored properly. So this is the main focus as far as the regulatory concern is there. Quality, we have to stick with the quality, and our quality is quality of the drug is very high quality. If you see the genetic medicine, India is producing largest genetic medicines, and also USA more than 30% of the local market is being catered by the genetic medicine of the Indian drugs. So as far as the quality, but we have to more concerned about the quality of the product. Whatever the medicines, medical devices are being manufactured, there should be the quality product. And or lot of other measures have also been taken. And pharma sector in India, as Dr. Dua has told, it is the big sector. It is not India is known as the pharmacy of the world, and more than 40 billions of the US dollar this market size. Position third in the volume, and value it is 30. If you see in general value and third, compare the size. If you see that this value of the product and volume of the product, volume is in volume Indian industry is approximate 13 or 12th position globally. Why it is so? One of the reason is we are producing quality drug at a affordable price. So affordability of the medicine is also there. So the Indian pharma industry is no doubt will grow, and whatever the new policies given by the central authority as well as the state policy, definitely this pharma sector will grow, and we will have the ecosystem in development of the medical and pharmaceutical sector in the country. Thank you very much, and my especially thanks for Dr. GNC for giving me that. He is lot of I have learned lot of from the decision. Always he is giving guidance me from time to time. Thank you very much, sir.
Thank you, sir. Thank you very much, sir. So I think it was as I was discussing with Dr. Dua Saab and Dr. Asim Sahuji, as well as again, I think my senior and again mentor in the pharmaceutical profession, Dr. Jain Singh, sir. So I had a great discussion with everybody, and there was a question. Say in UP, we have the implementation of the the central rules related to the stability studies, and after submitting the stability data, we are going to get the approvals. And in other states, we have say in Himachal, we have the formulation can be approved in 7 to 10 days if it is existing, not for the new molecule. So again, we're going to make it uniform in coming time when the central portal will be launched. So I think, Dr. Dua, I think it will be when it will be uniform, then the time required is say for one molecule which is already approved, it will be around 6 months. So it will be there. So I think either they will be slow or then again UP will be equal to them. It's a big question. How we are going to manage, because in UP, if we want, either we say we have to recommend the government for some subsidies, some extra subsidies, because other states, if they can afford, why UP cannot afford? That is one question. And if we are talking about the regulatory rules, say the 6-month data or something, if then again the same thing will be implemented, then again UP will be lagging behind. So if we are not giving the environment for the industry so that some in form of some subsidies or something extra. So it's something like UP, for the industry, for the pharma industry to come to UP, there is something extra is required. So this is my summation. If Jin Singh sir, I think I'll be needing your view, and after you, Mr. Gupta can say how IPA UP can, in coordination with your good self and the state machinery, how they can forward this to the state government. Sir, Dr. Jin Singh sir.
Well, thank you, Puneet. And I'm very lucky to listen Dr. Dinesh Duaji and Asim Sahuji, who has rightly put the finger on the issues. And Puneet has rightly raised the issue how to resolve and make UP as one of the transparent, vibrant, and doable state. I can assure you the Honorable Yogi ji is doing all the groundwork. We have made many things to be put in place. Only we are waiting for appropriate time. As you are aware now, the government is going to be on election mode. So we don't want to make any commitment which could not be able to fulfill. Everything has been put in place. Duaji has rightly raised the issue how we are going to have a very enabling system so that the environment of UP for investment be friendly. That is going to be already, most of the components have been taken care of and been put in place. We are going to have online approval. Means if you apply a day, we would ensure that within 2 days, all the things be cleared from the desk itself. Or we would be making enabling provisions so that when an entrepreneurs or an industrial person comes to UP, immediately he be given all the opportunity to have the license in his hands, basically in few hours only. Why we may delay for 24 hours, 48 hours? If he is fulfilling the basic requirements, it has to be addressed. For that, we are taking care of. So timelines would be taken care of. The second ease of doing business that the Honorable Chief Minister is working very hard. His officials are also working. The Food Safety Drug Administration is also playing a rightful role. Only the things we are going to strengthen the regulatory mechanism in UP so that ease of doing business could be properly addressed. And Puneet, I can tell you with certainty, in times to come, UP would be a very favorable destination. We are well aware of most of the issues and the challenges which normally entrepreneurs or the people normally faces. We are going to address it. As you know, it was a very, from inertia, if you are going to make them into, give a jerk, it requires some time. And those time have been now over. I am fully confident in another few months, you would be seeing a vibrant, a dynamic, and a ready to welcome the industrial houses to invest in UP. And the pharma sector, the medical devices, as Dr. Sahu has rightly mentioned, now the CDSU has made each and everything to be enabled and friendly. Dr. Somani is doing good job. Dr. Iswar Reddy has made good contribution. I feel in times to come with the support of FOP, IDMA, and the other institutions, with a special reference to IPA, when you people are there, we would be finding out the mechanism to address the issues, and a special cell would be created by the UP government where most of the issues be addressed promptly and spontaneously. And we would be taking help of Duaji, who is a very important person of our discipline, who is having such a wider exposure. And we are very fortunate during this COVID, he played a very significant role. This is how the vaccine, if you take the vaccine delivery system, the medicines, and the other things for medical devices, he has fought he not fought, he pleaded the system so well that things are going to take proper shape. And Asim Sahu, your role would be very important in times to come because you are the custodian of the regulator in the North Zone. We would be requesting you kindly keep on having frequent meeting with the Food Safety Administration of UP and let whatever the issues come of the stakeholders could be addressed suitably. And I am here to assist you people in whatever way you think proper, either in a personal capacity or to the advisor to our CM or as your brother. I am ready to do that. Hope, Puneet, I have answered your questions a little bit. Many things we would be keep on addressing as and when the times emerges. Amit ji, your hand, you have raised the hand. You may unmute and kindly take the permission of the person and then you proceed.
Yes, sir. Thank you so much. I am going to first put down my hand. I keep forgetting where you get it down, lower hand. Okay.
Okay, sir.
So I am very grateful for the opportunity to having participated in this, and especially with respect to Dr. Dua's suggestion about stability studies of known medicaments. I have a suggestion that I hope will find favor with regulators, not just for UP, but for the world instead. Look, we reconcile to the fact that when we're talking about generic formulations, we rely on bioequivalence and bioavailability studies to say that a generic is equivalent to the innovator product. I think we have a very easy way forward if we can implement what is known as what could be known as packaging equivalence. Now, a product in its distribution or market intended packaging has undergone stability studies at the level of the innovator. And if through material testing, in the sense of packaging materials, for example, strip packing aluminum foil, if the product is offered by a generic maker in the same packaging, I believe that the stability data then becomes redundant. It doesn't really inform the regulator of anything. It doesn't protect the consumer beyond what is already known. And therefore, I believe that this emphasis on stability studies, if on known drugs, on generic formulations mainly, can be very easily overcome if we can sort of persuade the regulator to understand that if the packaging is equivalent, the stability is equivalent. That is one thing. The other thing that I wanted to say is that, look, Dr. Dua started to talk about manufacturing in the 1970s and the 1980s. And at that time, the mainstay of production in terms of public health was public sector manufacturing. And I, being a central government person, I will not focus on UP, but I would try to urge the pharmaceutical industry throughout the country. And since I'm a science person, I will say that since science has no borders, I believe that there are, much of regulation these days, and I'm sorry to have quote Mr. Donald Trump of all people, but I believe that pharmaceutical regulators have got too deep into issues that really do not matter either for safety or for abundant caution or for quality or for whatever professed, let's say, objectives that regulations are being implemented. So if I were to be given an opportunity to suggest that for public health, for a company with for a country with limited resources like ours, we really need not feel embarrassed about the quality parameters that we have for generic medications, for hospital supply, for use by the large populations of India, if they do not sort of conform to the norm of the ICH and big pharma induced regulations. So what I'm saying very briefly, but if given an opportunity, I can expand upon it. What I'm just saying is that I believe that it is now time to revive public sector manufacturing because it no longer poses a competition to private enterprise, and at the same time does provide a certain kind of bulwark or a buffer, or let's say a fallback option for public health manufacturing. I had the opportunity to speak to a top bureaucrat in Uttar Pradesh, well, UP, the previous UP pharma policy was being formulated. And he was of the opinion, for example, that UPDPL, which was set up by the initiative of my institution's previous director, Dr. Nityanand, no less, cannot be revived. I do not think that this is a valid option. I believe that there is time for us now to look at public sector manufacturing, try to go back to our UPDPL, KDPL, Rajasthan, and IDPL, all of these things, because the contribution by volume to the market by these manufacturers is not significant in usual times. But in times of crisis, as we noticed in case of Days Chemicals in Bengal, public sector manufacturing, despite being not profitable, is now in a situation where it does not really offer serious competition either to MSME or to large companies or big pharma, for that, international. And I believe that there must be some kind of attention to the prospect of trying to revive public sector manufacturing and distribution, especially for public health needs. Thank you for giving me this opportunity to say my word.
Puneet ji, thank you, Mr. Raji, for your valuable sessions. And Puneet, with your permission, I have got another meeting at 2:30. If you permit, then I may leave with paying my gratitude to Dua ji, to Asim Sahu ji, Gupta ji, and all the panelists who have come over here and giving session. And please forward the outcome so that I can follow up with the UP government in whatever capacity I can. With these words, Arya Gupta ji, kindly permit me to leave and convey my regards to Honorable Member of Parliament, Dr. Anil ji. He is the jewel of Ghaziabad region and Uttar Pradesh and of the country in totality. He promised me last time he would be creating a very enable environment for UP, and he is doing that job. With these words, I express my gratitude to all of you. Namaste.
Namaste.
मैं अमित बोल रहा हूँ। सिंह साहब
जी
तो
सर।
गए
जी सर।
और हम 3 लोग बचे हैं। अगर आप अपना अगर आप अपना YouTube लाइव बंद करें और रिकॉर्डिंग बंद करें
जी
तो मैं आपको खरी खरी सुनाऊं।
वो कहीं वही सुन लेंगे सर, सीधे सुन लेंगे हम लोग, सीधे बैठ करके। तब तो फिर आगे बढ़ाएंगे 3 से 4 हो जाएंगे। ओके सर।
अब मैं लीव कर लूं फिर मीटिंग।
ओके सर।
ओके
ओके सर। ओके। डॉक्टर पुनीत, हेलो डॉक्टर पुनीत।